Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello, listeners. Welcome to Business Innovators Radio. This is your host, Constant Taylor. Today, we have a very special guest on the show, and they're going to share some very exciting information with us. So, if you're looking to increase your professional and personal effectiveness, then you've come to the right place. Our special guest today is Hassan Tetteh. Hassan has been speaking professionally for over 10 years, and the content that he primarily speaks on is health and wellness and healthcare. He has spoken both nationally and internationally and is based out of the D.C. area. His current book is called Gifts of the Heart, and his book that's coming out soon is called The 7 Pillars of Life. Hassan, welcome to the show.
Thank you. Thank you, Tom. Thank you.
I'd like to kick off the show by asking you if you could tell the listeners a little bit about your speaking and consulting business and how you help your clients become more effective in the healthcare and the wellness area.
Sure. Well, thank you for the opportunity to be on the show. I really appreciate it, and for giving me the opportunity to share some insights and some of my experience with your listeners. I like to play, if you will, in the intersection of policy, business, and healthcare. I am a physician, but I've had a lot of experience in business and in policy. And I've noticed that there is a lot of opportunity sort of in the intersection of all those three subjects. So what I like to do is make connections for people, particularly in the consulting world. But in my day-to-day job, I try to solve problems and use the experience and the background in business and policy to leverage those solutions.
Okay, so backing up a little bit, how did you make the transition from being a doctor, a physician, into the consulting arena?
Well, I think that, in fact, it happened in some of my coursework when I studied in my MBA program. We literally had to start a company, and one of the companies that I decided to start was a consulting company, particularly because, again, I saw a need as healthcare was rapidly changing to provide some expertise to professional physicians and healthcare providers. And so I like to see my role as helping physicians deliver better care to their patients.
Okay, so that was my next question: is who do you help, or who are your primary targets? And that would be physicians.
Physicians and healthcare providers in general.
Okay.
So whether that is from at the corporate level all the way down to the individual physician.
So with Obamacare coming through in the last few years, I'm sure that there has been a ton of support that has been needed to try to unravel and understand that program. How has your company supported that initiative?
Sure. Well, that's a great question. And fortunately, I had a lot of insight into some of the changes that were coming at the policy level, far before they became, well before they became law, in fact. And I had the great opportunity to be exposed to some thought leaders and some of the folks that were actually shaping the policy at the federal level. And listening to them and their insights, I think gave me sort of a head start in terms of what was coming in terms of change. So I'll give you a very concrete example. Back in 2009, some of my colleagues that I work with in the private practice world, specifically for cardiac surgery, were in the middle of and were contemplating whether or not they should negotiate with the hospital to become employees, if you will, of the hospitals.
Mm-hmm.
You know, traditionally, many physicians have been really entrepreneurs. They've graduated from medical school and sort of hung a shingle out and sort of took care of patients.
Mm-hmm.
That model is quickly evaporating in terms of a sound business practice now, just because of the way things are structured, both from a reimbursement as well as just policy level. So I shared some of this insight with these particular physicians back in 2009, well before the Affordable Care Act was even signed into law, which was in the spring of 2010. And I was summarily dismissed in terms of their willingness to accept the fact that things were going to change on such a level that, had they considered potentially negotiating and thinking about how they might, leverage their opportunity and sort of their position, if you will, with the hospital, rather than do all of that, they basically felt that they were in a position where they didn't need to change anything. They didn't have to negotiate with the hospital, and they, basically, like many others, thought that things were going to stay the same forever, and that model was going to exist in perpetuity. But it didn't, and it changed. And now, many years later, they're faced with a great disadvantage, because now the hospitals have the upper hand, if you will, and just have a lot more leverage just because of the way things are structured. So it's that kind of information, bringing that kind of information, bridging the policy, the business, and the healthcare world. That's where I like to see, my value proposition.
Okay, and that's very insightful, and it happens in so many industries where you have a business model that's existed for so long that the people that are inside of that bubble think that, hey, it's going to go on like this forever. I have an automotive background, so I've seen things drastically change there, where we've had to change and adjust that, and the same thing happening in the medical industry. Very insightful. Now, what are some of the popular misconceptions about the value that you bring to the table, and how do you dispel those misconceptions?
Sure. Very good question. I think one of the popular misconceptions, particularly when I talk to some of my physician colleagues, and then even when I speak to perhaps some healthcare executives, they have a tendency, and I think this is very common in healthcare, to silo individuals and say, well, you can't possibly understand my problem because you're simply a surgeon. You're only a surgeon. You only know about surgery. And that is true. I do know about surgery. However, I think I've had a unique experience, in part because of my military background, certainly because of sort of my entrepreneurial spirit that's given me an opportunity to delve into different kinds of businesses outside of healthcare, that I have this sort of practical real-world experience that I think brings a lot of value and insight into, general problems that any individual may face, but specifically those in healthcare. So I often hear, well, you're just a surgeon. You couldn't possibly know about my problem. And what I think is that surgery actually has provided me with a discipline, and that's been augmented, as I said, with my business experience, my policy experience, and just, as many entrepreneurs know, the school of hard knocks. And that experience is invaluable. And that provides me with a unique perspective for recognizing trends and applying practical knowledge to people, to the problems that people face.
Yeah, that's you have a very unique and diverse skill set, which you've got the medical, you've got the business with the MBAs, which allows you to provide to add substantial value. So I can definitely see how you can help them in that area. Now let's take a step back because of your unique experience and background, which is very fascinating. How did you always know that you were going into the medical industry as a child? Can you take us back, the decision that you made to get there up till now?
Sure. Yes, I certainly knew that I wanted to be a physician early on in life, and certainly a lot of my early decisions in academics and in terms of my education certainly, were made because of that dream or desire, if you will, to become a physician. And once I was in medical school, I realized that I really liked working with my hands. I liked the creative aspect of surgery, and I liked the challenge of surgery. And I also liked the gratification of knowing that, you could do something and directly impact the person's life right away. And so that was really what was exciting to me. So that drew me there. And now it was while I was, in my training in surgery that I started to recognize, and I had the wisdom of my dad to sort of help me to look at life through a different lens, if you will. And one of the things that he always impressed upon me was this concept or this belief that, you always have to look on the horizon and see what things are coming. They may impact or change the way your life is going right now. And he impressed that upon me, even in medicine and in healthcare. And so I think I always had this sort of vision that I should always keep my peripheral vision open and not be just tunnel vision. And so, yes, while I was learning about the skill and the science and the art of surgery, I was always looking at the trends of what was going on outside of surgery and outside my world of medicine. And that just attracted me to, be interested in policy and looking how government and laws and different policies, if you will, dictate or change something. And what was fascinating to me was, as you know, and you alluded to, just look at the car industry or look at any industry. You can have a law or something that is changed or a policy that's enacted, and all of a sudden an industry leader can automatically become in a position where they're obsolete or their technology no longer is relevant. And so and that I guess gave me this belief that medicine was not immune to that. What I did appreciate in medicine, though, is that things happen a lot slower in healthcare. So what you might see in the telecommunications industry or the transportation industry in terms of a trend happening, they're a lot faster. Those industries are much agile. But in healthcare, things are very conservative and things move very slow. But nonetheless, they are still impacted by those same forces and dynamics that occur in other industries. And I think that as I started to learn more and more about that phenomena, it just gave me this great interest in learning more about policy and learning more about business and doing that in a more formal and also informal way.
Okay, excellent insight. I appreciate that. Now, when your engagements, I'm trying to conceptualize and visualize how you engage with organizations or physicians. Is this at conferences? Are these one-on-one sessions? How do you consult with the healthcare industry?
Sure, it's in all of the above, if you will. So it certainly is in one-on-one sessions. It's also in conferences, and it's also in some of the day-to-day work that I do. And I'll give you some examples of each one of those. Certainly, as I mentioned, earlier with that story, my colleagues, I talk to them on a daily basis, and now I've come to appreciate or really enjoy when folks will ask me questions about policy issues or business issues because they know that I've mentioned something to them that they've come to see and has come to fruition. For example, this is sort of an aside, but a couple of years ago, I told a friend of mine that I was reading about chip technology in credit cards, and with my background in the military, I knew that we were using that in our IDs. And I told her that, soon in the U.S., there's going to be a trend where everyone is going to have a chip in their credit card. And in fact, it's a shock that we haven't adopted it earlier because certainly in Europe and other countries, that's the norm. And she just emailed me a couple months ago and said, hey, I remember you had this conversation with me, and all my credit cards now have a chip. I just got a new one in the mail. So that's just one example, but there are plenty of those in healthcare as well. But at a conference level as well, I have the great opportunity and privilege, in fact, to be one of the educators and speakers at one of the foremost education and healthcare conferences in the country, and that's coming up in the spring of 2016 in Chicago. It's the American College of Healthcare Executives Conference. It's called the Clinical Congress for the American College of Healthcare Executives. This is really one of the most premier organizations for healthcare executives, many in the C-suite and certainly, at every level, below in healthcare, the true leaders in healthcare that are, shaping sort of the industry. And I'm going to be speaking on a topic that, on surface would probably not necessarily engender a lot of interest, but what my role is going to be is to really show, again, how there's this intersection of policy, business, and healthcare, and how there's incredible opportunity there. So my topic is actually called humanistic communication and leveraging diversity to improve health outcomes.
Okay.
And so I was selected among many applicants to be a speaker, and it's going to be a 3-hour session with some breakout opportunities for the audience. And that program is something that I've delivered on a couple of occasions already, and even at the University of Louisville as an invited speaker to give a half-day conference on diversity and humanistic communication. Now, you might ask, well, what does diversity have to do with healthcare and improved outcomes? Well, again, because of this insight that I've had in business and studying cases, I, many years ago, came across a really great article that was written by an individual who was at the Harvard Business School. And he did a profile, if you will, on IBM and showcased how IBM was one of the most diverse companies in the world. And it wasn't because he just wanted to show that they just thought this was a good thing to do. No, in fact, his article is probably one of the sentinel articles that really drove, the Fortune 100 and 500 companies to really adopt this principle of diversity and a strategy for diversity as giving them an edge for the competition and making them more relevant in a more global marketplace. Mm-hmm. And so what IBM did back in the early 2000s and late 90s was their then at the time CEO charged his leadership with going to traditional groups, both underrepresented as well as well-represented, and charged his leadership with finding out from those groups what it was that IBM could do to improve their relevance in those people's lives. And what came of that were incredible product lines that IBM still to this day carries, and it affected and impacted their bottom line. It made them competitive. And I'll give you one example of that. And one of those examples was one of his leaders was charged with finding out from the people with disabilities community what it was that IBM could do to better serve that community. The person that was in charge of that initiative was not a person with a particular disability, but he engaged with that community, using all of the principles in business that you do, engagement, research, market research, focus groups, etc., and learned through some members in the organization that actually at the time there was legislation, to go back to the policy, legislation being enacted in Congress that was calling for accessible technology. Mm-hmm. Because there was a group of individuals that was lobbying for that. Mm-hmm. And when IBM found this out, they developed a whole service line and product line around accessible technology. Now, because of that initiative and because of their desire to look into this, sort of diverse world, if you will, and do something that was a little bit different, they developed a product line that was worth to them, over $1 billion, mm-hmm. and then became the market leader in accessible technology. So now most people that are technology companies, when they have to, develop technologies for individuals with disability, they go to IBM because they're the leader and they have that corporate knowledge. They have that knowledge, if you will, because that's where they invested early on, and so they became the market leaders in that. So I take that as an example, but then I bring bring that into the healthcare world and show how that same kind of exercise, that same kind of focus, that same kind of strategy can develop product lines and improve the outcomes for the populations that some of these healthcare leaders are serving.
It makes a lot of sense from a business standpoint. Using a sports analogy, if you got 11 quarterbacks on the field, then you've got 10 too many people that are actually thinking alike and have the same skill set. So having a diversity in skill set, diversity in thought, diversity in background and culture, which really gives you a different perspective, it just makes good business sense. So I agree with that. I'd like to, and it's amazing how quickly the time flies when you have a very interesting topic and concept what you're involved in, I'd like to cover another area and get your thought from a thought leadership perspective. You saw the healthcare industry changing in terms of Obamacare. There's also a shift going on with the holistic industry, where things that were traditionally treated by medicine and operations, people are seeking other alternatives. I'd like to get your thought from a professional physician's perspective, and then from your thought leadership, your business, your MBA, and your medical background.
Sure. Well, let me first say that anybody that has a particular condition or certainly a health problem should definitely consult a professional, first and foremost, someone that has that expertise in that area. Mm-hmm. Having said that, however, I like to think of myself as a practical speaker and a practical, thoughtful person, if you will, and I certainly try to bring that to my speaking. And so from that standpoint, I look at this as, we have incredible technologies in healthcare, and there's no doubt and question that it's because of our technology, our advances in science, that we've been able to push the envelope in terms of, increasing longevity and improving health and wellness for the population. But at the same time, even though we have all of that technology and we have all of those things at our disposal, if you will, we still are far behind in terms of where we probably could be and should be. And so I would never summarily dismiss, alternative medicine, because alternative medicine has been around for thousands and thousands of years, well before what we call Western medicine, sort of became in vogue, and certainly helped individuals and continues to help individuals. And it's all a matter of what works for an individual. And that personalized kind of medicine, that personalized kind of care, I come to understand and appreciate, not only because, of my own experience in healthcare directly as a provider, but also as someone on the receiving end of healthcare, if you will. And I know there's a incredible connection to the mind and the body and the spirit, and what one believes works for them oftentimes does in fact work for them. Mm-hmm. So I'll leave it at that in a very general way, but I also will, provide this caveat, and that caveat is, if you look, across the world, there are certain populations where they don't have access to our Western, very advanced medical technologies, if you will, but yet they live long, healthy, and very productive and fulfilling lives. Yes. So there's something to that, and looking at what those folks are exposed to in terms of behavior and diet and sort of environment, are all things that are very I think informative, and I think that's really where this kind of industry is going. They're looking at to see what works, what has worked for other populations, and just like any other industry, you're really working to serve the needs of everyone. And in healthcare, we're really trying to get everyone to a place of being healthy and not necessarily maintaining sickness.
Right. Okay. Excellent insight, and I'm personally glad to hear your perspective on that. What I see in the industry is, you talk about resistance to change, is that there's a revenue model, and with this revenue model, it's backed by a lot of different procedures and a lot of different operations. And if there's something else that's going to maybe challenge that model, there's a lot of resistance to that from what I've seen in the industry.
Right, and I think that as you probably can see, and it's not hard to tell from the trends, I think everyone from individuals all the way to the highest echelons of government are realizing that we invest a lot of money in healthcare, but we don't necessarily get health. We get a lot of sick care, and I think that's where our industries are going to start moving toward, and those leaders in the industry are going to really start to look at how those dollars invested translate into health and well-being for individuals and vitality, and vice just maintaining chronic illnesses.
Now, if the listeners would like to get in contact with you or your organization and learn more about the services that you provide, what's the best way for them to do that?
Sure. There's my website, which is drtetteh.com. That's DOCTOR, and my last name, TETTEH.com. They can follow me at they can follow me on Twitter at Dr. Tetteh, and that's again DOCTORTETTEH. And email me, Hassan at drtetteh.com. Happy to have a chat, to learn about any issues that I can help out with, and always willing to learn more about other individuals and the challenges that they face.
In 1 minute or less, could you leave the listener with one thought where, if they don't get anything else out of this interview, this is the message that I would like to leave them with?
Sure, and that is the main reason for resistance to my service, if you will, which is that of providing thought leadership and insight. And the main reason for that resistance is typically fear. When you sell the idea that an individual or organization needs to change, it becomes uncomfortable. It's very easy for individuals and businesses and any organization to ignore the signs and continue business as usual thinking, and that things will always be the same. So my sort of parting words, if you will, for the audience is that change brings opportunity and new life, and that's what I like to think I deliver.
Well, Dr. Tetteh, this has been a very, very insightful and powerful interview for me, and I'm sure for the listeners. And we appreciate you taking the time out of your busy schedule to speak with us. And this was awesome. Thank you.
Oh, thank you. I really appreciate the opportunity. Thanks so much.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.